right, Dr. Emer, we're live.
Hey guys, it's Dr. Emer. We are here day one with our patient that had surgery yesterday. You guys were asking how everything was because you watched his story on Instagram and Snap, and he's doing very well. Take a look at his before. You could see there was some disproportionate areas and some areas of irregularities on his stomach, and then the chest area had a lot of looseness, very little upper muscle size, and there's some looseness along the sides and below. There was some sagging there. So now if you take a look, you can see the chest border is much more defined. We have elevation in the chest, in the upper portion of the chest, so that the lower portion is now straight. You can see the indentation in the middle part of the chest showing the muscular definition, and you can see his six-pack starting to form. We had to do a mini tuck because he had a lot of loose skin and irregularities. A very small mini, this is one of the smallest ones you'll see, a very small directly into the semilunaris lines, and you can see also those lines being developed right through here. A lot of this was breaking apart that scar tissue, removing the disproportionate areas of fat. I love that you can actually see, if you press here, you can see where his natural ab shape is and how much we're defining it. So you can see here, he had a lot of lack of definition there, but now you can actually see it. I'm going to show you guys really quickly the 45 degrees so you could take a look.
Did he get ab surgery? We did some ab etching.
Yes,
it's like GLADIATOR lipo.
More of a natural look. And what's the biggest thing difference here I notice is the difference between the chest and the stomach, because here from the side you can see the problem area fat down at the bottom. Take a look. Now it's perfectly flat, but you could see what the before was like, where there was a lot of extra fat there. Now take a look, it's completely flat. Look at the chest as well. I'm going to show you guys that here, the sagging through here and the roundness at the bottom. Now if you take a look, the roundness is at the top and it's perfectly straight at the bottom. So that's how we make that gladiator chest. That's how we make the overall improvement in the stomach area, getting more definition and strength. And this is really only that one day. This is actually pretty amazing to have very minimal bruising. Again, with the internal heating, allowing us to get a better result, allowing us to get a much more skin tightening, reduction in the irregularities, and improvement in the overall definition. And we'll really start to see that at about 1 month. So we'll start to see this improvement over the next week. We're doing aftercare, which is essential. Lymphatic massage, hyperbaric, and IV therapy is truly going to help him heal much faster and get rid of any risk of complications. So I'm very happy with this, you guys. He is doing okay because I knew you guys were always concerned. Take a look at this result. It's going to be quite amazing. This is our gladiator makeover.
But what do we start? But what do we start in 3 weeks?
In 3
Fraxel,
weeks, you guys have
VB.
to start aftercare in terms of lasering and then also doing some body treatments. And so we will start lasers. Skincare is immediate. We're going to do on all these scars once the tape comes off. And then other than that, it's on to getting him back into the gym in 3 or 4 weeks. Have a good day, guys. Perfect. Looks really good. All right.